Primary mediastinal B-cell lymphoma is a rare, uncommon lymphoma that affects typically young patients in the age of approximately 30 years with a female predominance and a large mediastinal mass that is very symptomatic at diagnosis. The biology of this lymphoma is uncommon with a genetic that is close to classical Hodgkin lymphoma. And we know that PMBL patients have a very good prognosis with standard immunochemotherapy, R-CHOP-like based, but there is a subset of 10 or 15% of patients that are typically refractory to this standard chemotherapy, and there is no tool to anticipate, to predict the failure of chemotherapy. So we perform a molecular characterization of a large cohort of patients from the LYSA centers. We add the clinical data from 300 patients, and we make a molecular characterization of approximately 200 cases. And we use gene expression profiling with 137 gene assay and next generation sequencing after a pathologic review. We observe that a subset of 30% of PMBL cases have a poor prognosis and have an overexpression of both PD-L1 and PD-L2 immunosuppressive genes. So we identified for the first time a subset of patients with a strong immune privilege and at high risk of treatment failure with standard immunochemotherapy. So we believe that our gene expression assay may serve as a companion diagnostic to identify the subset of high-risk patients that might benefit from anti-PD-1 therapy from the first line.